Hi everyone, my name is Edsel Magtoto. Everybody calls me Zed or Dr. Zed. I'm 30 years old and currently I'm a practicing resident physician specializing in internal medicine at the Medical City in Ortigas, Pasig. So my main concern of coming here is my jawline. Everybody says that a sexier jawline makes someone more appealing and more attractive. And especially with my age, that I'm already in the 30s, marami na ako nakikitang changes when it comes to my physical attributes, especially sa face, no? I have a little concern with regards to the symmetry of my face. Medyo asymmetrical yung face ko, especially on the right side, no? Mas prominent yung jawline ko on the left side. So, with the advancement of aesthetics, I know that CSA could really help me out, figure out a little change and improvement with regards to my jawline and the appearance of my face na hindi naman ako nag-undergo ng surgical procedures, no? I have few concerns with regards to my skin. As you can see, I also have acne scars before. I've suffered from acne when I was in college, and currently CSA has been taking care of my skin for quite some time already. I have known Dr Contessa since I was in med school, and I have really trusted her, and my loyalty is with her up to this moment that I've already become a doctor. Kaya ngayon, with the new changes sa mga bagong ino-offer and services ng CSA, nandito ako para itry yung tinatawag nilang Restylane fillers in redefining the jawline. Kaya I'm very, very much excited. Don't forget to subscribe, hit the notification bell, and leave a comment para sa mga inquiries nyo with regards to this procedure. You can also follow me on my social media accounts. You can search me on YouTube. Just click on Dr. Zed Updates, or find me on Instagram, TikTok, and Twitter. Just type in @dr.zed, Z-E-D, para you can follow me and we can talk about health, lifestyle, and medical. Ayan. Hope to see you there.
Good day everyone, welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a topic, the so-called jawline enhancement or jawline redefinition. Today, we have a new guest. Let's all welcome Dr. Edsel Magtoto.
Hey guys, thank you for having me, Doctor.
Yes, Doc. Okay, so Doc has been with us for quite a while already. Like we've been doing treatments of like acne marks and also some enhancements.
Yes.
And Doc is still looking so young. He's a resident doctor, internal medicine, right?
Yes, Doctor.
Yeah,
Actually,
so-
I came from duty.
Okay.
24 hours, but I came straight
Pero
here
look
for
at
the
you.
shoot.
Still fresh, right?
Thank you.
There you go. So a while ago, Doc shared with us regarding about this lower part of the face, the lower third, including the jawline area. And he was sharing with us, he noticed an asymmetry, right, Doc?
Yes.
So looking at Dr. Zed, okay, Dr. Zed, I also noticed that the right side, as compared to the left, there is like this part here, there's no prominence of the angle of the mandible. It's like, Doc, it's inward or parang nakatago.
Nakatago,
Right,
exactly.
Doc? But as compared to the left side, you can see that L-shaped angle of the jaw there. Kasi the angle, when you say angle, it's like a 90-degree angle there. Now, Doc kasi, he's good looking already. It's a matter of just balancing, making the look like symmetrical there. Because we define what is an attractive face. It's more of being defined as within proportions, within like a balance or symmetry, or they have this mathematical formula, Doc, yung golden pie proportions.
The golden pie,
Yes,
yeah.
ratios and proportions. So we just wanted to balance the lower part of the face. And we wanted a procedure na non-surgical. We don't want to manipulate or cut. We don't want to do like altering of the anatomy. And the good thing right now with our technology, we have these products that are very safe. They have been clinically studied, scientifically studied yan. Importante sa ating mga doctors and doc. Evidence-based
Evidence-based
medicine
muna
tayo.
before we proceed with something.
Yes, correct. So right now, at least we have a product that's natural and of course FDA cleared. Now the question is, how do we do it? Of course, it's also significant that the one doing the procedure is really trained, okay, and of course certified.
True.
So we undergo a lot of trainings, studies, even though it's a continuous studying.
It's a continuous study, continuous learning. And practice, syempre.
Exactly.
Marami actually na nag-offer sa akin.
Yes, Doc.
I've been mentioning that.
Yeah.
Pero since I was a medical student, talagang as a doctor, and of course, sa mga viewers natin, you always have to support yung mga talagang well-trained doctors, kagaya ni Dr Contessa. So yung loyalty ko talaga always with CSA.
Thank you, Doc. Yan, even kasi right now, no, in the medical field, no, ang daming mga, actually, Doc, may reports nga, mga hindi pala licensed doctors, pero practicing daw, pero not licensed pala. And of course, in our field, we continue to do our research, we continue to really attend conventions, not only nationally, but internationally. That's why right now, globally kasi, we can already share informations, we can share techniques, we can share all discoveries and learnings. Thanks to science, thanks to our medicine that is also updating us with everything. Yes, so for today, Doc, our technique will just be simple for you.
I'm very excited actually kasi nga, well, a lot of people know that I'm doing endorsements online,
too, yes,
no, sa Instagram, most importantly, and some on the TikTok na rin.
Yeah.
So every time I post photos, or minsan I do it on my own kasi nga I'm very busy, and some of my mga editors ko hindi rin nag-fit in yung time namin. So when I do the shoot myself, nahihirapan ako kasi nga asymmetrical yung face ko. So I find my own angle, which is quite difficult, diba? Dapat pag model ka, any angle eh. So I'm very excited for this kind of procedure, and kaya nga ako nag-IM doc because I don't like bloody procedures, no? So I want non-surgical, and I know that this is painless and safe, kaya
yun, painless and safe. Those are the words. And of course, with instant natural result. O yan, ano kaya ang procedure and product that we will use? Ating abangan sa pagbabalik ng CSA Medical Aesthetics. And we're back, so we're doing a jawline treatment for Dr. Zed. But before we do that, let's do our markings of the areas where we will be doing our procedure. So on the right side of Doc Zed, we notice that the jawline here is not so much defined, right, Doc?
Yes.
We needed more definition on the right side. Now for our markings, so we make the borders of the lower mandibular part here as our inferior line, Doc. And then the posterior line is here at the posterior of the ramus of the mandible. Okay? And also, I make a marking anteriorly from the oral commissure here to the mandible part there. So that's the anterior border. So this is like part of our jawline region here. So if you notice, the lower third of the face is basically on the mandibular area. That's why for treatments of this part, like for young ones, Doc is still young, okay? It's more of an enhancement and really highlighting the attractive features of the face. For men kasi, it's ideal that the shape of the face is like a square shape, Doc, right? And men really wanted this defined jawline and some bulk of this angle of the mandible. So you wanted, Doc, na prominent itong angle. And like for women, kami, narrower yung lower face namin. But our mid face, yung cheek area, yun ang dapat sa amin, prominent. But for men, it's more of the angle of that jaw. Ito nga po. We call the gonyon angle, Doc. So this part is the one we want to highlight. And at the same time, make this mandibular line here, or jawline here, smooth and well-defined. And we also want to prevent aging na rin, Doc. We wanted to prevent the appearance ng what we call pre-jowl sulcus or the jowling here or the sagginess here. So our treatment will also prevent aging. And especially if you're using product that's also present in your skin, of course, it will help in rejuvenation and regeneration also. Okay, Doc? So, and we want a product that's really gonna give that lift and at the same time that projection. So we wanted to project this angle of the jaw laterally. So for men, you want like a broader or wider jawline or a square-shaped jawline. Right now, Doc, amongst Korean, they like the chiseled jaw. Even our K-pop men, right? Yes. They have this well-defined or even sharp jawline or chiseled jaw. So for men, that's where we really worked on the lower third of the face, emphasizing this gonial angle here. So since this is our borders for our jawline, so actually we have a different treatment, the center, the chin, that's different also, but it's part of our lower third treatments. Now for this jawline here, what we do is we have to identify where do we place the product material that we will use for you. So since we want to define this area here, directly onto your angle of your mandible, we need to place product material here. Now I'll be using two methods for Doc. I'll use needle method as well as the cannula method. So when I use the needle method, I'll just inject directly here, bolus of my product, and really inject it onto the bone, Doc. Okay? So later on, Doc, I will be very gentle, and the good thing with the product, it has a lidocaine, so that you will not feel any discomfort there. So that's for my needle method here. Another method that I will do, so it's a combination method, Doc, will be the cannula technique. So I can use actually the same entry point here, and then direct the cannula upward or superiorly towards this body of the, or the ramus rather, the mandibular ramus here, and then another entry point going back towards that body of the mandible here. So this is the ramus, this is the body of the mandible. Now here, I will place product here on top of your masseter, Doc. Okay? So this is really filling in your corner of your jaw here. And then this part here is just to making that line really well defined and not irregular or wavy, and preventing the sagginess and aging also. So I will be doing the cannula method here, retrograde fanning technique. Okay? So since I'll be working on the right side first, and this is the area that as we have seen during the assessment, it's the area that needs more filling in, right, Doc?
Yes, po. The right side talaga.
Yes, Doc. So for now, I'll be using a high G prime product, high viscosity, and at the same time, it's gonna give us that lifting, projection, and precision, and it has a tissue product integration. We'll be using the Restylane. The Restylane, these are lines of dermal fillers that really were well known for having that high G prime property. Okay, Doc? The high G prime, when you say G prime, Doc, it's the ability of the product material to resist deformation. And it will stay in the location where we want it. So it's not gonna spread into the tissues around it. So we just wanted it to stay in that mandibular area there. And as to the anatomical location, initially, I'll be injecting direct onto the bone, so supraperiosteal. Okay, Doc? So my assistant will now clean the area. So a while ago, we applied topical numbing cream, and we left it for about half an hour. And then, so of course, it's very significant we follow the asepsis, antisepsis rule. So we want to prevent infection also. So my material will be the high G prime dermal filler. It's a large molecular weight or large particle size type of our hyaluronic dermal filler. I want using also hyaluronic because these are very natural. You find them in your tissues, you find them in your system, in your body. So they're biocompatible, Doc. And the good thing with this product, it is also lasting longer. So they made they have a technology whereby they stabilize the product material. Like in our biochemistry, doc, for you to stabilize a certain molecule, you have to do a chemical bonding. They just did like a chemical linkage of this product, doc. Yun na. Chemical bonds, doc. Biochemistry. So Doc Zed was with me during our biochemistry years. So now my injection point is direct onto the angle of the mandible. So Doc, I'll just direct it onto the bone, okay? And then, once I reach that deepest layer, so Doc, talagang deep yung mandible bone mo. So that's why we really have to project it. Now, I can use a 0.5 ml of my product here. I'll just do bolus injection, Doc, and push it here. So I am in a safe anatomical location actually. The facial artery is located at the antegonal notch while I am pushing my filler. So the antegonal notch is here. So I am away from the facial artery. So this facial artery has a branch going to the oral commissures. It will give off your inferior and superior labial arteries, Doc. So your antegonal notch is here. I'm away from that unsafe zone. So for injectors, they know this. They want to avoid this mandibular notch here where you have your facial artery coming out. It's a branch of our external carotid artery. Okay, so I already pushed my half ml of my Restylane lift, the Restylane lift. So now I'll do the so-called, so that's the needle method. Now I'll do, Doc, the cannula method, okay? So avoiding my antegonal notch here, I'll be palpating for this posterior part of your ramus of your mandible. I'll make a puncture point there. Inhale, exhale, Doc. Okay. I need an entry point here so that I can insert my cannula. So this is a gauge 22 cannula. Are you okay, Doc?
Okay naman.
Yeah. So far, so good.
Yes.
Okay. So review of our anatomy and biochemistry, Doc. So we know that the hyaluronic, Doc, it's a glycosaminoglycan. It's like an amino polysaccharide. And it's responsible also in biochem. We were told it's for the skin turgor. And it's water humectant. So I will actually direct first my cannula towards this ramus of the mandible. So I want to fill this in. So I'll fill this in with half ml of my Restylane, Doc, okay? So just gliding, and there you go. And I am in a subdermal plane already here. Okay, so I want to be on top of the, for example, here we have the parotid gland and the masseter, Doc. So we want to stay in the layer 2, which is the subcutaneous layer. So we want to fill that in and just push the product. The good thing with my cannula, it's gauge 22. I easily can glide it into this layer here. So just a fanning technique, retrograde fanning technique, we can push our half ml of our Restylane. So again, this is the part that I want to volumize more as compared to the left side. So I can go back here and fill that in. So once I have delivered my half ml into this ramus of the mandible, so Doc, anatomy talaga, it's significant. For injectors, you have to be familiar. You have to master your anatomy. Anatomy is important for filler injectors. Okay, now I'm done with that ramus. Now I want to go to the border, lower border or inferior border of the mandible. So now I can direct my cannula towards this part here. For individuals who also wanted to correct their lateral chin area, you can use the same technique, okay? So I'll now glide this cannula subdermally or in the subcutaneous layer. Take note, we have a facial artery coming out here. But the anatomical location of that facial artery is deep onto the bone. So my cannula is above. So I'm in layer 2. I can avoid the deepest layer using my cannula. That's why in filler injections, when you use cannula, of course, in terms of safety, dahil it's blunt, it will not nick any blood vessel there. It's blunt eh. So, as compared to the needle, of course, the needle sharp, it is sharp, it will nick a blood vessel. Right, Doc? So, I am also in the right anatomical plane. I'll just glide this towards the jowl part there, although Doc doesn't have any jowls yet. So, it's just the jawline definition treatment. Okay, just glide ko lang, Doc. And I will push my product already. I can also do the so-called fanning method here. I'll add a little bit. Take note that we noticed already in Dr. Zed's photo that he already has a good jawline actually, but it's just that there's an imbalance, right, Doc? Mm-hmm. We just wanna make it symmetrical. So I can use like 0.25 mil here, okay? So basically, that's for the right side of the jawline area. We'll proceed to the left. So we're now proceeding to the left side of the face. So I'm injecting right now on the left angle jaw. We have done the left side. We'll show the result to Dr. Zed when CSA Medical Aesthetics return. Back, so we'll now show the result to Dr. Zed. Doc Zed, here's our mirror po. There you go. Yeah. So the left and the right. I mean the left and the right.
The left and the right. Yeah.
Okay, so how was it, Doc? So far?
Happy ako kasi mukhang symmetrical na yung face
yes,
ko.
Yes, Doc. As much as possible, we want to balance it. On the right side, we have placed more of our tissue product there. And we have used combination needle and cannula methods. Now, for Dr. Zed, of course, we'll still see more of like improvement of this kind of treatment because the material will still like integrate inside, and plus these are water humectant, so you will still see like more of a projection on the sides of the lower third of the face. Plus, it will blend pa po, Doc. It will integrate. So knowing these are hyaluronic and it's like a high molecular weight product, it will still give you that lifting and that more of firmness as well as prevention of aging. May tightening and yun nga, so more defined na yung jawline. Plus yun nga yung the balancing of it. Yun lang, Doc, we've used more of the product here. Like we've used like a total of, because some doctors are asking me, Doc, how many did you use? I used a total of 4 syringes of Restylane. So this is just to give that more projection on the like bigonial, the bigonial width, Doc. So yung gonial angle mo, we really wanted to emphasize it. Parang yun nga yung letter L. Actually, Doc, I'm here, I'm looking at the side. I can see na a letter L shape of this right gonial area, Doc. So how was the experience, Doc? Or anything you would want to share with our televiewers?
Honestly, yung term na tolerable is not even tolerable kasi it's totally painless. Mababa yung pain tolerance ko as a doctor, and totally kanina when we were doing the procedure, wala, halos makatulog na ako because I'm so comfortable. Doc. Wala akong naramdaman na pain at all. I'm very happy with the results. It's fast, it's quick, it's easy, and I can go back to work tomorrow.
Correct.
Which is very parang maganda para sa kagaya kong doktor and with a very busy schedule. Walang downtime, I can go back to work.
Exactly. Yes. And we only advise, Doc, do some cold compress because you know naman we did some injections there. Every after we needle injections or like cannula insertions, we ask you to do like cold compress. And after this, doc, with filler, you can still do like a molding and a massaging of it. We give time for the filler, like 2 weeks time for it to totally integrate well. And it will bind with our natural tissues there, doc. Yan, ang after effect lang, naturally enhanced, younger looking. Actually, he's young. Lalo pang magiging young. And plus, of course, it's very safe talaga. Plus, the technique that we've done, good thing the Restylane has lidocaine with it. So, we use Restylane Lift because for every product, they have different kinds of names and different properties. Merong kasing high concentration, merong low concentration. So, we have done the dermal filler injections for our jawline enhancement. We're so glad to have Dr. Zed with us. I think we still have more projects with Dr. Zed next time. So, enhanced naman na, but I'm looking at Doc because he's always busy, doesn't sleep early or rather sleeping hours probably 2 hours only.
2 hours to 5
during
duty,
5 hours, no? Yeah. Kasi I'm looking at the upper, of course, we've done the lower part of the face. We're checking on the upper third. Ayan, of course, talagang darating ang time, you're gonna develop like fine lines there. So, for Doc, we just wanted to of course, maintain that good skin texture. And later on, Doc, we'll still do, kasi I'm looking at the mid-face section of Doc. Actually, there's more of the prominence of this mid-face area. We can do like Ultherapy to balance it with the right side, Doc. So, it's the making our face really symmetrical. Thank you so much, Doc.
Thank you very much, guys. I highly recommend those who really wanted more defined jawline. And di ba sabi nga nila kapag may jaw sa lalaki, mas sexy yung
mas
dating.
sexy.
So
masculine and sexy.
Yeah, masculine and sexy are the right term. So I highly recommend this and come visit us here sa CSA and look for Dr. Contessa.
And if you wanna ask questions pa kay Doc Zed, anong nangyari? How will they reach you, Doc?
Yes, guys, you can always follow me on my social media accounts. I also have a YouTube account. They're gonna flash it on the screen. It's dr.zed. You can find me on YouTube. Search nyo lang Dr. Zed Updates. Ang Instagram, TikTok, and Twitter ko, dr.zed. So, I hope to see you guys there. You can follow me there and ask questions. Anything medical, health, and lifestyle.
Correct. I follow Doc also. I'm learning from him too. Thank you so much for all those informations, Doc. Very helpful.
Thank you very much.
And if you also have questions on us, especially on this treatment, you may email us at csaskinclinic@yahoo.com, FB page CSA Medical Aesthetics, Instagram CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragol, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. And please do watch our other video episodes. Just look at our YouTube channel, Contessa Salvador Alapag, and please do click the subscribe button and the notification bell for you to be always updated. Okay, thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.